Hello and welcome. I would like to start by thanking you for considering us for your procedure. The purpose of this video is to inform you about breast augmentation, also known as breast enhancement with implants. What is breast augmentation? It is the enhancement of the breast by increasing its volume and improving its shape when using breast implants. Patients who are good candidates for the procedure want to enhance its shape, improve its symmetry and balance, get a breast lift, improving their cleavage, and obtaining a rejuvenation of the breast. Breast augmentation is not meant to reshape breasts with significant skin laxity as shown here. A breast lift is also needed in this case. Contraindications for patients undergoing breast augmentation include breastfeeding or milk discharge. This may increase infections, breast infections, and finally, breast cancer. We will do a complete medical history. In addition, we will focus on breast disease, histories of breast cancer, and the impact of pregnancy on your breast. Now let's review some important considerations in preparation for your surgery. In preparation for your surgery, your health should be as good as it could be. Medically stable, especially if you have hypertension, diabetes, or anemia. When it comes to the labs, I would require that your hemoglobin should be greater than 12. Finally, ideally your weight should be stable or close to ideal. One of the most important topics in preparation for your surgery is to stop smoking. Please do not smoke 4 weeks prior to your surgery and 4 weeks after your surgery. This includes cigarettes, marijuana, and hookah. Also, please stop any blood thinners. This may increase bleeding during your surgery. Smoking has been demonstrated to increase complications with this procedure. Please do not smoke. In preparation to your surgery, we will request a mammogram. Usually this is indicated by the age of 40. However, if you are planning on surgery, it will be ideal to obtain a test starting at age 35, or 10 years earlier than the youngest family member diagnosed with breast cancer. Thereafter, you should obtain your regular mammogram every 2 years from the ages 40 to 49 and every year thereafter. For out-of-town patients, we'll ask them to arrive 2 to 3 days prior to your surgery. They should stay 5 to 7 days after the procedure. We'll require a medical clearance. Now let's discuss some of the things that will happen during your consultation. We'll do a physical examination, including your current breast size and the desired breast size that you want to achieve with the procedure. We'll do a cancer screening, looking for masses, dimpling, discharge of fluid through your nipple, and lymph nodes. In our discussion, we'll talk about the desired breast size that you would like to achieve. However, remember that a cup size varies with the various companies that fabricate them. For example, a C cup at Walmart is equivalent to a D cup at Victoria's Secret. My compromise is to create a new breast that fits your body, at the same time that will look more youthful. In the long run, huge is not always better. However, some people might be in disagreement. Then we'll discuss various aspects related to the implant that we will choose for your surgery. Some of the aspects to consider are the volume, the filler, the surface, the dimensions, and the shape. Let's start with the volume of the implant. It is recognized that between 120 to 150 cc of volume increases by 1 cup size. I will give you a range of maximum sizes that could potentially be used. This is limited by your body characteristics. Then, it will be up to you to determine how big you want to be based on that range. At the end, all this is just an estimate. The final decision will be done when we use the sizers during your operation. My goal is to give you the best volume and shape while keeping the natural look to your breast. Finally, be aware that the bigger the implant, the most harm we can do to the tissues in the long run. This is how we will select your implant. We'll try different sizes without knowing their volume. Then you will tell me what you like. I will tell you when we are at risk of having an implant too big that may put you at a risk of having a side breast. I like to increase the implant sizes by 50 cc's, for example, 250, 300, 350. 50 cc's only changes your cup size by a quarter of a cup. It is just an extra layer of silicone, 3 mm taller and 5 mm wider, not enough to make a difference on your new breast size. I will downsize the implant during surgery if it feels that it's putting you at risk for lateral displacement. Let's talk about breast implant fillers. In summary, there are two types: saline solution and silicone. Despite the advantages and disadvantages of each type, my recommendation is to use silicone fill implants. These implants will give you a more natural result. In addition, the newest generations will provide an increased level of safety when compared to prior generations of implants. We can discuss more in detail during your consultation any concerns that you may have. Breast implant surface. Texture and smooth. My recommendation is to use the smooth breast implant surface. Breast implant shape. Round or anatomical. My recommendation is to use the rounded ones. My preferred way of doing breast augmentation is under general anesthesia. I prefer to use the implant underneath the muscle. The duration of the procedure is between 45 minutes and 90 minutes. There are different incisions that can be used for the insertion of the implant. My preferred method is the inframammary fold. It gives me the best control for the execution of your surgery. In addition, it's usually well hidden. The other approaches have some advantages. However, the access to the surgical area is more difficult, reducing the level of control. We'll place the breast implant using the dual plane technique. In the superior portion, the implant will be covered by the muscle, as shown here. In the inferior portion, the implant will be covered by the breast. This is an actual video of a patient that underwent this procedure. After creating the pocket underneath the muscle and the breast, we insert the breast silicone implant. If your breast tissue is very falling, a breast implant might not improve the shape of your breast. In those cases, a breast lift may be the solution to the problem. The first possible procedure is a periareolar mastopexy. It is indicated in patients with grade 1 ptosis and a relatively good skin envelope. The procedure will address the position of the nipple and, in some cases, the position of the breast tissue. The advantage is that the scar will be relatively well camouflaged within your nipple. The disadvantage is that the scar can widen. The breast might look flattened at the beginning and you will have some pleating around the nipple. All these issues usually improve in 2 to 3 months after your surgery. The second possible procedure is a vertical mastopexy. It is indicated in patients with grade 1 through 3 ptosis. The procedure will address the position of the nipple and the position of the breast tissue. The advantages are that the scar will be intermediate in size and partially camouflaged. The disadvantages are the pronounced upper pole, flattened lower pole, skin redundancy of dog ears, and skin breakdown. The most popular incision is the inverted T-scar. We will incise around the nipple, in the middle of the breast, and at the inframammary fold. The indications for the procedure are grade 3 ptosis, which is severe, and poor skin quality. The goals of the procedure are to reposition the nipple and to redistribute the breast tissue that we leave behind. At the end of the procedure, the suture will look like a pie crust. It will look like bunching and dimpling as shown here. The purpose is to remove the tension of the sutures at the healing point. This will favor a fine line scar as shown in the next slide. This is a patient that underwent a breast lift. You can see her 1 year after her surgery. This is a typical look of a patient that underwent a breast augmentation. The implants usually will be high riding. The breast will be located at the low position. In addition, the abdomen will look swollen. Now, let's discuss some events around your surgery. 2 days before your surgery, we will encourage you to start preparation of your skin using an antibacterial soap called chlorhexidine. I will also encourage you to start a full liquid diet. This will decrease the bowel contents and it will favor the surgical outcome. The addition of milk of magnesia will help cleanse your intestine. Do it gently to prevent massive diarrhea. It is very important that you remain well hydrated. The day before your surgery, you need to stop eating or drinking after midnight. I will encourage you to take Tylenol 650 milligrams every 6 hours, starting the day before your surgery. At the day of your surgery, at 4 o'clock in the morning, with a small sip of water, you're going to take your usual medications. You will also take Tylenol 650 milligrams pill. I will ask you to hold your diabetes medication. This is the progression of your dressings after your surgery. You will have an ace band after your surgery that will be removed after the first week. Between the first and the second week, you're going to use a bra with a soft band. After the second week, you will use a push-up bra for life. This will prevent the lateral displacement of the implant. Usually, we don't use drains with breast augmentation. We may use them if you have a breast lift or increased bleeding during your surgery. The duration of the drains is between 1 to 2 weeks. Pain-wise, most of the patients have a moderate level of pain. Usually they describe it as a working out pain or burning pain. The score is between 5 to 7 over 10. However, it is well controlled with the pain medications by mouth. We'll give you the specific regimen the day of your surgery. We'll use multiple medications for the control of your pain. We'll use Tylenol at 9, at 3, at 9, and at 3. We'll use ibuprofen at 6, at 12, at 6, and at 12. We'll use oxycodone every 6 hours and Valium if we work with your muscles. After your surgery, you will have nausea secondary to the medications used for your anesthesia. We will encourage you to eat light food, and you can work your way up as you feel better. You will go home the same day after your surgery. We will encourage you to walk to prevent clots that can travel to the lungs. This is how you will follow up after your surgery. In the first week, you will have your first follow-up. Then you will be followed weekly until your drains are removed. A regular follow-up will happen at 6 weeks, 6 months, and a year. However, we'll encourage you to contact us if you have any questions at any time. Now let's discuss some frequent asked questions related to this procedure. Size after your breast augmentation. Unfortunately, I cannot promise you a cup size. Once again, remember that the breast size varies with the various companies that fabricate the bras. My compromise is to give you a well-balanced breast that fits your body. This is how your breast size will change with your breast augmentation. It may increase with gain of weight. It may decrease with weight loss. Gravity has an effect in our bodies. After breast implants, long term, you may need a breast lift. Please use your bra at all times to try to delay this event. Breastfeeding and breast implants. It might be abnormal in 35% of the cases. In a study, cow milk has been demonstrated to have more silicone than milk from patients with silicone implants. A common question is, when should I replace your implants? Let's start by saying that you do not wait to fix things until they are broken. The implants come with a warranty of 30 years. However, I recommend to exchange them every 10 to 15 years to deal with the rupture. You do not wait until the tires of your car explode to change them. Some reasons for replacements are change of size, correct the pocket band position, capsular contracture, and implant rupture. The usual time off after surgery is between 3 to 7 days. You'll feel like 80% of your normal by 6 weeks. After your surgery, you're encouraged to walk to try to prevent clots in your legs. Please do not lift heavy. In the first 3 weeks, you need to lift less than 5 pounds. Between 3 to 6 weeks, up to 10 pounds. You might get back to normal after 6 weeks. Activity-wise, no lifting of more than 5 pounds in the first 3 weeks, 10 pounds in the next 3 days from 3 to 6. You can go back to normal after 6 weeks of your surgery. Massaging the breast will help prevent capsular contracture. Please do it inwards and down, never to your side. Once again, avoid displacement of the breast implant to the sides by activating the pectoralis major muscle. That means no bench press, planks, or push-ups for the rest of your life. You can shower 1 week after your surgery. However, you're encouraged to do sponge bathing until that. How to avoid infections. Do not use a cloth on your wounds. This might carry some bacteria that might affect your healing. We'll encourage you to use antibacterial gel soap as shown here. If you have drains, we'll encourage you to use peroxide to the entrance point of the drain to try to kill bacteria. Finally, when you dry up, use a dry, clean cloth to avoid contamination. When can I drive again? When you are off narcotics. If not, you will be considered DUI. Usually it takes between 1 to 2 weeks, but it varies by procedure. How likely do implants leak? Unlikely. Not even a 2-ton car can make the breast implant rupture. What if I have an implant leak? The gel is cohesive. Even in the event of a shell leak, the gel should remain together. When cutting the implant in half, the gel stays in place. When squeezing the implant after cutting the shell, the silicone still remains together, as shown by this video. This is different from the implants from 30 years ago. At that time, the gel was an oily substance that did not stay together. Breast cancer surveillance. Continue your daily palpations. Continue your doctor examinations. Your next mammogram should start at age 40 and yearly thereafter. Stretch marks and breast augmentation. In rare occasions, if you have them, they might become rarer. Now let's talk about risks and complications. The purpose of this section is to inform you, not to scare you. The more that you know, the most likely the operation will succeed. I have always believed that knowledge is power to my patients. Let's start by recognizing that the more tissue that we need to remove, the most likely we will run into complications. However, I will be at your side the whole time to help you sailing through any problem we run into. Asymmetry is the most common issue with this surgery. I will point out in your consultation the differences between your breasts. Remember that the implant will magnify these differences. Nipple asymmetry is fairly common. This is an example of a patient who had nipples at different levels preoperatively. Notice how it looks more noticeable after the augmentation. Capsular contracture. Remember that any device placed in our body will develop a capsule. That is the case of pacemakers, meshes, and of course breast implants. The contracture is the result of muscle-like fibers within the normal capsule that your augmentation will develop. The main finding to look for is hardening of the breast, with changes on the shape. In some cases, they may be painful to the patients. If present, we'll need to remove the capsule and replace the implant. Unfortunately, the likelihood of recurring is higher after the first time it happens. Now let's talk about a very uncommon complication that has had the attention of the public media. It is the anaplastic large cell lymphoma. It happens in 1 per million patients, which is equivalent to 300 patients in the United States. It presents as a chronic fluid collection surrounding the breast implant. Very odd, but you need to know about it. The implants come with their own insurance. You guessed right. If it's free, it almost never happens. Selling implants are covered for 10 years for rupture. Silicone implants are covered for 30 to 40 years depending on the company. I recommend to get the additional insurance. It only costs $300 as of this recording. It will cover you for 10 years. Another way of seeing it is $30 per year. Definitely money well spent. It will cover you for capsular contracture, anaplastic large cell lymphoma, replacement of both implants, and it will give you money towards your surgery. Rippling is the presence of a wavy shape of the breast as shown here. It is more frequent in augmentation filled with saline solution. It is usually present in patients that have a small amount of breast tissue and decided to having their implants on top of the muscle. In the majority of the cases, the treatment is replacement and relocating of the implant to under the muscle location. Nipple changes after a breast augmentation. The nipples can be hypersensitive or hyposensitive in 15% of the cases. Persistent nipple erection may happen but is very rare. Migration and tissue changes after breast augmentation. The implants will follow gravity. Some of the conditions include double bubble as shown on the left, or thinning of the breast tissue to the point that the implant will be exposed. I will give you the maximum range of breast implants that your body will hold based on your frame to make this procedure as safe as possible. Sympmastia is the connection of both implant pockets in the middle, favoring lack of definition of the breast, and it is usually the result of trying to improve the cleavage by removing the inner attachments of the pectoralis major muscle of your chest. I will avoid this complication by keeping the muscle attached to its original insertion. Reoperation is a given condition after breast augmentation. Remember that the breast implants are like tires. They have a limited lifetime and they need to be replaced due to their tear and wear. In addition, one of the main reasons for reoperation is because the patient wants to be bigger, or because of any of the already mentioned complications. Poor scars. Unfortunately, the scarring process is unpredictable. As you know, I cut and got heals, or your body heals. You may need future revision when healed from the current surgery, usually within a year after your surgery. You might encounter also asymmetries. Skin numbness happens in the surrounding areas to the incision. It usually improves over time. It may recover within 6 months to a year after your surgery. Delayed healing may happen. It is the skin necrosis or death secondary to high tensions. It is more frequent in patients that smoke, Please do not smoke 1 month prior and 1 month after your surgery. 1 month after your surgery. Nipple loss or sloughing. This is more frequent in patients with big breasts, in which the distance from the blood supply to the nipple is very distant. It could be present as a partial or complete loss of the nipple or areola. The management is with dressing changes. Depending on the healing, we might need to do tattooing or nipple reconstruction in the future. Infection may happen in less than 1% of the cases. You will receive antibiotics before and after your surgery. If present, we will change to a different antibiotic by mouth. If there is no improvement, we will need to hospitalize you to give you antibiotics through your vein. Depending on the response, we will need to remove the implant and come back later, once the infection is under control, usually between 4 to 6 months after the complication. Bleeding is reported to happen in less than 1% of the cases. It may show like black and blue, and an increased size of your breast. Please let us know to address this issue. Swelling or skin discoloration will be worse in the first week. It will progressively become better during the second week. However, the final outcome will be obtained 3 to 6 months after your surgery. We can improve it by applying cold compresses for the first 72 hours, followed by warm compresses until the bruising is better. In rare cases, there might be damage to the organs, including nerves, blood vessels, muscles, and internal organs. Deep venous thrombosis is the presence of clots in the legs that might travel to your lungs. The day of your consultation, I will be evaluating your risk factors for developing this condition. If your risk is high, we might need to give you a blood thinner to prevent this condition. Independently if you are at high or low risk, walking is your best friend after surgery. Please start walking the same day after your procedure. Finally, unsatisfactory result. Unfortunately, I cannot guarantee an outcome considering that I have no control over all the variables. Here you will find a list of all the complications that we have discussed so far in the presentation. I will do my best to avoid these potential complications. Most importantly, I will be always to your side, trying to correct any potential issues that may happen. Now, let's review some patients that have undergone this procedure. This beautiful patient underwent breast augmentation. We used 250cc silicone breast implants in both breasts. She underwent from an A cup to a C cup. In this patient, we used 300cc silicone breast implants in both breasts. She went from an A cup to a C cup. In this patient, we used 350cc silicone breast implants in both breasts. She went from a B cup to a D cup. In this patient, we used 350cc silicone breast implants in both breasts. She went from a B cup to a D cup. In this patient, we used a 400cc silicone breast implants in both breasts. She went from an A cup to a C cup. In this patient, we used 450cc silicone breast implants in both breasts. She went from a B cup to a D cup. In this patient, we used 250cc silicone implants on the right and 450cc implant on the left. She went from an A cup and B cup to a D cup. This patient used 500cc silicone implants in both breasts. She went from a B cup to a double D cup. In this patient, we used 500cc silicone breast implants in both breasts. She went from a B cup to a D cup. In this patient, we used 550cc silicone breast implants in both breasts. She went from an A cup to a double D cup. In this patient, we used 600cc silicone breast implants in both breasts. She went from a C cup to a triple D cup. Finally, this patient, we used 600cc silicone breast implants in both breasts. She went from a C cup to a triple D cup. I hope that this video was informative and that helped you understand better the details related to your procedure. If you have any further questions, please do not hesitate to contact us. I'm looking forward to participate on your transformation. Thank you again for considering us for your surgery.